Hi everybody and welcome back. Mrs. Davis asked me to put together a short video to review the clinical portfolio tools with you for third semester. We have updated some of them based on the new curriculum that's being put forward, and I think you'll enjoy some of the changes. So let's get started. Follow along here. I'm going to turn off the video and we're going to move to Canvas, to the clinical class, the 43.1, and we are under modules. And the first thing that we're going to look at is the comportment tool of clinical attendance. This was the your attendance record, but in moving it to be aligned with our program learning outcomes, the name was changed to the comportment tool, record of clinical attendance. So you'll see here that the third semester is listed here, and you put your name here, and it's basically the same thing that you've always done. So you can see week 1, you're supposed to check that you were present for Tuesday and Wednesday, and then that just follows throughout the semester. It's 2 pages. If you have a clinical absence or tardy, there is a space here for you to mark that. There is also a space to mark that the clinical makeup assignment was assigned, and then the clinical instructor's signature that states that, in fact, it has been completed. So as you follow along down here, you'll see that there is a spot here for the clinical makeup assignment. It could be a VSAM, an ATI assignment, it could be some type of clinical assignment, and there's a spot for date assigned and date completed. And then if there are no absences for the entire 43.1 course, I'll change that, then the student signs here and the clinical instructor signs there. So basically the same thing as you've seen all along. So it's your responsibility to maintain the record. For all the evaluations that you have, you need to make a copy and bring it to your evaluation so the clinical instructor can see it. And then at the final evaluation, you make a copy and bring it to the evaluation. The original gets turned in and put in your file, and you get to keep the copy. So that is your record of clinical attendance. So now let's move on to the clinical portfolio completion validation. This is also in your syllabus. My suggestion is that you copy or print all of these from the modules, not from the syllabus. I think they make better copies coming through Canvas, through the modules. So you'll see that this is your clinical portfolio completion validation. These are the things that need to be completed during your clinicals. You will have a great opportunity of participating in medical surgical rotation, a mental health rotation, and then long-term care rotation at Windsor the Ridge, where you will be with me for long-term care, and you will be with Mr. Cebellino on the acute rehab side. So that's going to be some really exciting things there. So what you will have here is you have your daily data collection tool with all the regular usual parts that you have. For med-surg, you will need to complete the nursing care plan. For long-term care and acute rehab, there will be a concept map. And then there are also some geriatric assessment tools that will be introduced that you'll be working with, and then a student liaison reflection. In mental health, there will be some oral presentations, there's a daily reflective journal, and a chemical dependency meeting. Those assignments are specific to those rotations. For all of the rotations, there will be assignments in the communication tool, the caring tool. You will need to keep your skills validation checklist up to date, and then the interprofessional multidisciplinary team tool will also be utilized. We will not be using the diversity tool this semester. Pause for applause. Yay! So let us move on to the modules again and look at what the clinical portfolio tools look like for you in third semester. So let's look at the caring process tool first. Here you will notice that it does look a little bit different. Again, we're trying to match these to the program learning outcomes. And you'll see here for third semester that you will be doing a reflective journal. So it's no longer the caring tools of 1, 2, 3, 4, 5. You will be using those in your reflection. But what you will need to do for each rotation for med-surg, mental health, long-term care, and acute rehab is to provide examples of demonstrating caring behaviors with an increased awareness and/or sensitivity to the needs of clients with mental health conditions. So, especially during the mental health rotation, you will see that, but we'll also be focusing on that in your med-surg and long-term care and ARU rotations. So these go back to your course objectives, the program outcome, and then there is a quick review of Swanson's caring processes in case you forgot those. So knowing, being with, doing for, enabling, maintaining belief. And then for each rotation, so for example, here's one for med-surg, you will have to answer the following questions for your reflection. It demonstrated caring with evidence of increased awareness to the needs of clients with mental health conditions in a med-surg setting in the following ways, and then you're going to list those. And then your increased awareness impacted your nursing care by, you demonstrated caring with evidence of increased sensitivity, give examples there, you're able to advocate your patient with a mental health condition, and then you've learned that in the future, you need to do what? What will you need to do as far as communication and caring and advocacy with your clients? And then you'll notice it's already written out for you for mental health. It's the same questions, long-term care and ARU. Again, the same question, just in a different setting. So we really want you to be looking at how you look at clients with mental health conditions in the different settings. And then there is a grading rubric that you would use for each rotation. You need a minimum, it's actually 10.5 points, but 10 points to pass. We're not doing points. However, this does let you know, since it is a pass or fail course, if we set a benchmark then, and you meet the benchmark, then you pass that assignment. So that is the caring process tool. Let's move on to the communication tool. So this is called the Portfolio Communication and Professional Interaction tool. So here we are in third semester, and for the communication tool, remember we used to have the grid, and you had communications with the clinical instructor, the patient, the healthcare team. Now we're focusing on specific goals for you for each semester. So in third semester, we would like you to describe 2 situations in which you needed to contact the healthcare provider regarding a client's prescriptions or treatments. So that could be in person, it could be on the phone, any communication with the healthcare provider. Using SBAR, the students will describe how the client data was summarized before contacting the provider. So in other words, what did you do to prepare yourself to contact, to speak with the provider? It will document the interaction with the provider, and then what changed as a result of the interaction that you had with the provider. You'll reflect on the effectiveness or challenges of the communication with using the SBAR format when speaking with the healthcare provider. And then there's a little glimpse of what you'll be doing in fourth semester. So if we look down at the tool now, you'll see there is describe the situation. So there's a little spot there. And when you download the forms, you can make the space as big as you need to make it to describe the situation. And then what you prepare to say and what you actually said, right? So you will have prepared, you've written everything down, you're going to introduce yourself, give a situation, background assessment, recommendation, and then what you actually said. And then you're also going to, which could be the same, hopefully it's the same, and then you're going to record the response from the provider using exact quotations as often as possible, and then list what changed as a result of the interaction. And then you have the reflection part, which states that you've learned that you can identify whether your handoff SBAR communication are effective or ineffective by listing how you know that. Some challenges that you encountered were, lessons that you learned from the activity were, and ways that you can improve your handoff communication would include the following. And then here is the rubric, performance criteria. 1, 2, 3, 4. Yeah, so again, you need 10 points to pass, and you would be doing this hopefully in each rotation. But I will defer to Mrs. Davis and Mrs. Diamond in case they only want it in the med-surg and or long-term care ARU settings. So that should be, that's fairly self-explanatory. You're going to do 2 of those, right? Describe 2 situations. So you need to do that twice. Okay, moving on. That was the communication tool. Now we're going to look at the multidisciplinary tool. This is going to focus on care conferencing and or discharge planning in 3rd semester. So what you're looking at here, actually for 2nd and 3rd semester, is care conferencing and discharge planning. So hopefully you'll be able to attend a care conference or a team meeting or a discharge planning meeting. I know specifically in long-term care we will have that opportunity. And then you're going to answer the questions based on your experience. So you want to document everyone who attended and what their role is in the client's care. You want to describe one of the clients discussed at the conference using an SBAR format where you provide the current situation, background, assessments, therapies, recommendations discussed at the conference. And then you want to compare and contrast how the different team members collaborated to solve the client's problem. So talk about communication, any teamwork, any specialized focus, observations that you made. And then what critical assessment findings did the team consider during the planning and delivery of care? Was there something specific that happened? Did they need any specialized care, any specific discharge planning needs? And then describe any changes to the plan of care that were discussed, were new goals set. So sometimes you'll have a patient perhaps with a wound and it's healed, and so then the plan of care changes, or perhaps the nutrition for the patient will change, and so new goals would need to be set. Identify 2 activities or interventions that were to be implemented to optimize the client's response and restoration of health during the admission or for coordinating care upon discharge. So what were they going to, were tasks delegated? Did certain things have to happen? And which persons were assigned to be accountable for implementation and follow-up? Describe when and how you were able to be an advocate for the client during the care conference. If you only observed, that's okay. What would you like to have said? Or do you feel something was missing? And then what was the most valuable or significant thing you learned today? What made the most impact on you? Provide examples and rationales. And then this is the reflection piece of it. So the top part was the assignment. This part is the reflection. So you learned that the meetings can impact client care by. You learn more about coordination of care. As a result, you need to learn more about whatever it is you'd like to learn more about. Ways that you can advocate during a care conference, and ways you can improve in your collaboration strategies for future are. And those you list. And then there is the rubric, and 12 points are needed for a pass on this assignment. So there you have that. And then let's go on to the final thing here, which is the clinical evaluation form. This will be very similar to what you saw in 2nd semester. It will, however, be at the 3rd semester level. So things will be ramped up a little bit. You'll notice that there is a page for medical surgical, there's a page for mental health, there's a page for long-term care, and a page for acute rehab, because you should be getting some type of evaluation, after each rotation. So this should look very similar. Again, going back to the program learning outcomes, incorporate leadership, management, legal, ethical principles. This looks very similar. Role development, accountability, advocacy, the legal, principles, advocacy, and then looking at the ethical principles, and also leadership management, assuming the role of student liaison, delegating to members of the healthcare team, and then making sure that that attendance record, the comportment tool, is filled out accurately. And then this is the spot here after each program learning outcome where you will comment and give examples that show how you met the objectives. 2 is integrate caring into the relationships and nursing interventions that influence health outcomes. You're going to demonstrate caring and sensitivity to others' values and relationships and nursing interventions to achieve positive physiological and psychological health outcomes. So how did you look at age, gender, culture, et cetera, when providing and evaluating care? Helping clients and families communicate their needs, supporting their preferences. You can, we'll have the daily data collection tool, which will speak to that. The caring tool speaks to that, and we will not have the diversity interview tool in this particular case. So you don't have to worry about that one. And then again, student comments and examples that show how you met the objectives. The 3rd program learning outcome would be collaborative relationships. So employing and expanding collaborative relationships through communication, for providing physiological and psychological aspects of healthcare. So establishing the therapeutic relationship. In this particular case, you might be looking at different interprofessional team members, caseworkers, crisis team, activity director, psych techs, that type of thing. And then this is where the communication professional interaction tool will come in. Again, here's an area to write student comments and examples to show how you met the objectives. Number 4, providing competent evidence-based nursing care. You're going to apply the knowledge now, looking at national patient safety goals. You're going to complete an accurate assessments for 1 to 2 clients within 1 hour of the beginning of the shift. Seeks validation, consistently employs the basic rights of med administration. You will be working on safe Medicaid and taking your dosage calculation exam. Again, that'll be through the daily data collection tool, your skills checklist, the care plan or concept map, and a teaching plan, which will more than likely be incorporated into your care plan or concept map. And again, there's an area to show how you've met the objectives. Again, when you download the form, you'll be able to have as much room as you need to show how you met each objective. And then finally, employing the spirit of inquiry. You're going to model the spirit of inquiry. Again, talking about identifying gaps, seeking information, looking at analyzing errors and designing system improvements. And this will be evidenced through the care plan or the concept map, and again, teaching plan that would be incorporated into the care plan or concept map. So again, here is a space here for you to write your comments and show how you met the objectives. Remember last semester, you had this sort of grid that you could go week by week. You can still do that. However, this is not what will be part of the evaluation. You can use it as a guide, but you will need to actually, on the evaluation form itself, in the spaces that are designated, you will need to address how you met each of these examples, each of those key points, and how you met them. I believe that is all of the clinical portfolio tools. As a side note, I will be setting up the Safe Medicate for you, and I will also be getting together the geriatric assessment tools that you'll be using in long-term care and acute rehab. And if you have any questions, you can email me, or please ask Mrs. Davis or Mrs. Diamond, and they can get a hold of me. So I hope that you found that that was somewhat helpful, and I will post it on one of the pages, and I will do quick little mini videos for each of the portfolio tools. So hope to see you in clinical and see you later this week. Thank you so much.